I do want women to know that there is an alternative to suppressing their bodies with hormones, that they can see their body as a good and they can live in that body holistically.
Totally. Oh my gosh, it's amazing.
Join co-hosts Jamie Rocci and Teresa Kenny as they educate women about the beauty of the feminine design and empower women to take charge of their health.
They're going to be so amazing. You're going to be so empowered by understanding your feminine genius and your hormone genius. I don't think I could live my whole life knowing this and not sharing it with anyone.
Hello, welcome to the Hormone Genius Podcast. Jamie and I are doing an awesome podcast today on your mouth. And we have a guest that we have had on before, Dr. Katie Lee. She is a holistic dentist and has an amazing practice in Centennial, Colorado called Collective Health Society. We brought her back because Jamie and I were so blown away by the first podcast we did with Dr. Katie Lee that we were like, we've got to have you back and dive a little bit deeper into the mouth and why you should care about your mouth and the health of your mouth so much more than maybe you thought. So I'm going to ask Dr. Katie the first question. I want to know, first and foremost, what should we be thinking about in terms of, we talk about charting and the menstrual cycle and what are the signs that we see that tell us something's off in the body? What is it that we can be looking at, Dr. Katie, in the mouth? What are the subtle symptoms and signs that tell us that something is not right and we should be investigating that further?
Yeah, that's a really good question because the mouth really gives us tons of warning signs. And oftentimes in the past, people have just really thought that they were normal, but it's actually not normal. So the first thing that I always tell patients is your gums should not bleed. If your skin started randomly bleeding one day, you'd be pretty concerned that you had a flesh-eating disease, right? And that's essentially what, I don't mean to be dramatic, but that's essentially what gum disease is or gingivitis is. And so, but people have had this thought that, oh, my gums bleed, they've always bled. And it's like, no, literally your gums are breaking down right now and you have wounds inside your mouth. And we need to figure out what's causing that because it could be a whole host of different things. That's a big one. A change in breath status is another one. So if you're noticing that, oh my gosh, my breath is, not as fresh as it used to be, or it's not staying fresh throughout the day, that could be another sign that something is going on. And so those are really the two main things that I always tell patients to really start to look out for. And then for women, as we age and our hormones change, which I know we'll get into this, they'll start noticing a drier mouth and sometimes even a burning sensation inside the mouth. So that's something that we want to investigate as well.
Very interesting. The things that came to mind as you were explaining this is, for people that have canker sores all the time. So that's one question I have. Canker sores. And then also, you talked about if your gums bleed, people just think, oh, that's normal. But I always think about since your episode last year. So listeners, if you haven't listened to the first episode, go back and listen to the first episode from 2025 that summer. Since your episode, anytime I'm watching a movie or something, I know there's been at least 2 times where I hear someone says, well, of course my gums are bleeding. You're flossing them. Okay. In my head, I'm like, no, actually, that means that that means that there's a breakdown somewhere, or that there's a weakness, or there's an issue to look at. So in terms of flossing, so it's a 2-part question, canker sore and flossing, should we expect for there to be blood with flossing? Obviously it depends on how rough we're flossing, how rough should we floss? So those are the 2 things that came to mind as you were explaining the oral health.
So let's start with flossing. Okay. So if I scratch my skin, right, I'm not bleeding right now, right? So your gums are supposed to act as a physical barrier, much like your skin acts as a barrier for the body. So the gums are supposed to attach around the teeth and keep what's inside the mouth from going inside the body. What happens is when we have systemic inflammation is we release an enzyme called MMP8 from our white blood cells, and that enzyme's job is to break down collagen. And it breaks down collagen anywhere in the body, but one place it does it is in the mouth. So when the gums start being broken down, they literally are getting holes in them. So you get a wound on the inside of the gum tissue. Now the bacteria from the mouth can get into the gums, which is where the bloodstream is, and gums bleed because they have blood supply to them. So when the bacteria go from the mouth through the gum tissue, they get into that blood supply, and now they circulate throughout the body and go places that they should not be. So that's really what the problem is. And so if your gums are not being broken down by that enzyme, which means the inflammatory system or the immune system is not turned on, then your gums won't bleed. So bleeding gums is a sign that the gums are being broken down and that there's inflammation going on. So not good. Now, if you're flossing, you definitely don't want to create an injury, right? Like I could scratch myself hard enough to make myself bleed, but I'm not going to do that. So when you're flossing, you should use gentle pressure. Really, the only pressure that you want to put on is just to get below that contact point. And then you wrap the floss around, and what you're doing is trying to scrape the sides of the teeth. So definitely don't floss hard enough to cause damage. But if you're gentle flossing and you're bleeding, that's definitely not okay. Did that answer your question about the flossing?
Totally.
Yeah. And you'll notice, if you skip a couple days of flossing and you go back to floss, you'll bleed. And that's a sign that, your gums are being broken down and there's inflammation and infection there. But after you, floss that area for a day or so, it'll go back to not bleeding. And then you know that area is healthy again.
Okay. Awesome. And what about, go ahead.
Too, Jamie, like, are you wondering about like what type of floss? Because oh yeah, Dr. Katie's a holistic dentist. So we're trying to figure out like what's the most holistic way also. And we know that maybe some of the products out there are not as holistic as we want them to be. So I would like to know from the floss standpoint, what you guys recommend for flossing that's maybe more organic. I don't know if there is, and then also like toothbrushes, what do you guys really recommend? Every time I go to the dentist, of course they have the electronic ones, they're expensive. And I'm always like, do I do that? Is it really worth it? Do I just stay with a regular toothbrush? What kind of a toothbrush at this point? What is the best recommendation for those products?
So I would definitely say the best type of floss to do is the string floss. A lot of patients will come in and say, oh, but I use floss picks throughout the day. And I'm like, floss pick is the modern day toothpick, right? That's really all it's meant for is after lunch, you have food stuck in your teeth and you go in and you get that little bit of food out. They are not really meant to floss and clean your teeth thoroughly. So a lot of people use them because they're more convenient than string floss. But what you're doing is if you take that pick and you put it down in between the teeth and you're cleaning one area and you pull that up and you take that same floss pick and go to the tooth in front, now you're just transferring bacteria site to site to site. And when we see patients, when they come in, they may have gum disease or infection in just localized areas of the mouth. But if they're literally taking that floss pick and moving it everywhere, they're just transferring bacteria. So floss picks are good to keep in your bag for after lunch. But if you really want to try and keep your teeth clean, the best thing to do is to use string floss. And so you want to get like a full arm's length because every time you take the floss out, you want to change to the new fresh piece and wash your hands when you're done too, by the way. And that's kind of gross. And then, yes, in terms of types of floss that you want to use, so there's a lot of concern out there about using Teflon type products, that have plastics and forever chemicals in them. If you think like Glide floss, something that's real thin and smooth, and that probably has some chemicals in there that you don't want to be putting up next to that gum pocket, right? Because the blood supply is right there. So you want to be careful what type of product you're putting next to your blood supply. So there's a lot of really natural, holistic, healthy floss products out there. I love Boca floss, actually is my favorite. Living Well with Dr. Michelle. She's a great biological dentist that is a patient-facing educator on social media. And she has a lot of really great products. And she has a good silk floss that I like too. And another alternative that you could do is like a water flosser or a water pick. Those are actually quite good. And so for people who have kind of crowded, crooked teeth, or for older people or people who might have arthritis or something like that, and they can't really floss, water pick is just as good as long as you're doing it properly and getting it in between the teeth. It can be messy. So I tell people if you're going to water pick, do it in the shower. That way you're not spraying water all over your mirror and your countertop. A lot of people don't like to water pick because it is so messy. So take it in the shower with you. And then in terms of toothbrushes, yes, electric toothbrushes are by far more effective than manual. You're getting about, and I don't know these exact numbers, but you're getting about, let's say 1,200 strokes per minute on an electric toothbrush, but on a manual, you're getting about 70 to 80. So it's way more effective at cleaning your teeth. Plus, they have timers in them. So a lot of people think that they're brushing for 2 minutes, which is the recommendation. And I actually did a study in my office with Colgate years ago where we were timing how long patients were brushing their teeth, and it was under a minute. They ticked the box saying, yes, I brushed for over 2, and we were looking and it was actually under a minute. So I like electric toothbrushes because it tells you per quadrant when to switch areas. And then there's also many of them give vibration feedback if you're pushing too hard. So you also don't want to be scrubbing too hard. I tell people I don't care what toothbrush you use. So don't spend $200 on an electric toothbrush. They're not worth it. Go to TJ Maxx or Marshalls, and oftentimes they have electric toothbrushes on sale for like $30 to $50. Get those. Those are totally fine. But you want something that plugs into the wall, not a battery operated one.
Oh, this is so good. This is so good. Teresa, I'm kind of like you. I think I've had one electric toothbrush and I got it on Amazon, but it's probably like from China or something. I mean, it just didn't, it wasn't
fine.
It didn't work.
Oh,
it didn't work. I was like, I was so frustrated, or it was too complicated. Something about it just seemed like, meh. And I think I probably got it after our last episode. I'm like, I'm getting an electric toothbrush. Teresa, did you do the same thing?
I think I did. And I think I did the same thing. And I think the problem is some of them, like, almost like, I think they cheat you because the thing vibrates, but the teeth thing doesn't vibrate, right?
Yeah.
Like, and that's what I think you mean by the battery. Almost like the whole thing is vibrating, but it's not really like vibrating the teeth or moving the toothbrush thing. And it's probably just like one of those things. We're looking at like the on sale version and the reviews, and you just grab one. But I totally set mine back, after that.
But there's like a Sonicare. I think there's a Sonicare one for like $50. Like the base model Sonicare you can get at Target for $50. Just do that.
Just get Sonicare. Okay, so don't get the battery operated one.
No, they're like what you guys are trying to going to vibrate the whole thing. I mean, it's not really getting anything to the tooth, and the vibration you're getting is not really all that effective. More effective than a manual brush.
Right.
I just want to say something too, because I don't know. I remember growing up, my mom had the water pick machine. And I totally just remember going into our bathroom all the time and picking up the water pick thing and shooting like the water out. Yeah, like shooting the mirror or shooting my siblings with it, and then like shooting it in my mouth. That thing was strong, and it was legit. But my mom was always ahead of her time. She always had all the gadgets so I had those really water pick thing.
The water pick.
And turn it down. Like when you start with these things, especially if you're not used to an electric toothbrush or a water pick, you can put it on a lower setting to kind of get used to it. I wouldn't recommend like blasting your gums right away.
Okay. So before we shift into how oral health affects fertility, and we want to also focus around some of the perimenopause things, or at least start that conversation, what about people who get canker sores? I want to close that simple.
So canker sores, to my knowledge, we actually don't really know what causes them. There's really no science out there that says this is why you get a canker sore. But what I see oftentimes is that everything is caused, in my belief, and there's lots of science around this, by inflammation, right? And so canker sore is kind of like an autoimmune response that's happening in the mouth where we're actually getting ulcerations. And so whenever I see a canker sore, I always want to think like, okay, stop. Think, what caused this? Is the patient sucking on something super acidic and it's eroding the tissue? Do they have a hormone issue? Because a lot of times women will get canker sores around their period or during the hormonal change, we'll start to see them show up with that. So then we are thinking hormones. Other times it could be vitamin or nutrient deficiencies, or even, the most severe case is something is going on in the gut. So what happens in the mouth is mirroring what's happening in the body, and specifically the gut, because the tissue in the mouth, the cheek tissue, the tongue tissue, and the gum tissue is actually just an extension of our gut lining. And so if something is happening in the mouth, it's also happening in the gut. And so that's why we want to start diving into gut health if we're seeing a lot of ulcerations show up in the mouth. So that's why at our office, we have a gut health specialist that comes in. Because if I see something like that, I'm like, oh, I need you to go see our gut person because something deeper is going on.
Totally. Yeah, that makes a lot of sense. That of course it is a continuation. And I think that's the cutting edge revelation that maybe should have seemed obvious, that I think is becoming more obvious thanks to your work and people like you who talk about, this integrated health model. Okay, so now how do we understand our fertility in regards to the health of our fertility, and how does that correlate to the health of our mouth, our oral health?
Yes. So there's three ways really that oral health affects fertility. One is going to be through the bacteria themselves. So there's over 750 different types of bacteria in the mouth, and there's certain pathogens that have a direct impact on fertility. And so we can actually test patients for these bacteria. So I have patients that come in all the time that are planning to get pregnant or wanting to get pregnant or have been trying and it hasn't been successful yet, and they can't figure out what is, impacting their ability to get pregnant. And so we'll actually run a saliva test on them and see if some of these pathogens are coming up. So the two main ones that I'm looking for are Fusobacterium nucleatum. That bacteria, there's 5 different strains of it, and they're not all bad. But the problem with FN is that it can easily get into the tissues and move around the body. And then it also will take other bacteria with it and circulate throughout the body. So I kind of call it, it's like the Uber of the body. And FN, if someone has an FN infection, it increases their infertility risk by 300%, which is really significant. The metabolites of FN are actually toxic to the fetus. And so FN is responsible for stillbirths. It also will increase the MMP8 production that I was talking about earlier, that collagenase enzyme. And that will actually cause premature rupture of the amniotic membranes and could lead to miscarriage or early birth, early delivery. The other one that we look at is Porphyromonas gingivalis, or PG. PG is more associated with difficulty getting pregnant. So it impacts ovulation. It impacts the embryo's ability to attach to the uterus. And so depending on what the patient has, we want to treat them because the bacteria are treated differently. And in medicine, they've been doing tests for decades, for hundreds of years, to see what is actually ailing the patient and then tailoring the treatment to the test results. And in dentistry, we've kind of always just had this blanket approach to, oh, your gums are bleeding, we're going to recommend a deep cleaning. But what we know is that half of the bacteria in the mouth don't respond to dental cleanings. And so it's really important to know what's actually present so we can target treat the patient. And it's really important also that if we're doing a microbiome test on, let's say the woman, for example, that we're also testing her partner, because one kiss transfers over 8 billion bacteria. And so if you're kissing someone, which it takes 2 to make a baby, right, in the conventional sense anyway, you got to make sure that we're testing the partner to make sure that they're not infected. Because if I treat one half of the equation and then they go home and they're intimate with their partner, they're going to get reinfected again. So really critical that we treat everyone. There's PG actually in males impedes arginine production, and arginine is a precursor to nitric oxide. Nitric oxide is important for men to have to achieve an erection. And then the oral bacteria actually decrease sperm count. They change their morphology and can actually decrease their motility ability too. So if the infertility is coming from the male's side, we definitely want to test them with a saliva test to make sure that it's not oral bacteria that's impeding their ability to conceive. So bacteria is one. Second one is inflammation. So when you have a microbiome issue in the mouth or the bacteria are out of balance, that causes systemic inflammation. And when your body is on fire, it can't conceive, right? The body needs to be calm, restful, and in a state to achieve conception. And when you have inflammation that's coming from oral dysbiosis, you're causing systemic inflammation and elsewhere in the body. So we can see other things happen there in terms of fertility. And then the third piece of it is which is new to me, other people probably knew about this, but the impact of airway health on fertility. So a lot of patients, actually 85% of patients who have some sort of airway breathing issue, especially at night, like obstructive sleep apnea, are undiagnosed. And so this is a really big problem because it's very easily treated. But if someone has an airway issue and they're undiagnosed, they're actually changing the microbiome in the mouth. They're making the mouth more acidic, more inflammatory. They're decreasing nitric oxide production, and they're reducing the ability of oxygen to flow to the reproductive unit. And if they're pregnant, sustain the pregnancy.
I saw a patient just this week, and she has just signs of inflammation. Like, we have all our patients chart their cycle, and she's been through a lot of treatment and actually been treated for chronic endometriosis, which is thought to be inflammation and also potential bacteria in the uterus. And I'm just thinking, it's just so complicated when you think about these microbiomes, like from top to bottom. And I remember also learning about premature labor and its connection to the microbiome in the vagina, and also certain bacteria leading to premature rupture of membranes, like you said. This is really big. And I I do think, again, overwhelming to some degree. And for that patient that I had, it's making me wonder because we can't seem to figure it out. It's like we can't seem to get the inflammation under control. So then I'm like thinking, well, maybe we need to go all the way back up to the top. Sometimes like you're thinking about it from the source, from a fertility standpoint, uterus, genital region, all that kind of stuff. But we're not thinking about the mouth. And as you said, like the mouth, in fact, we were talking about this as the doctors in my office about how dirty the mouth is and how a human bite is considered like dirtier than like a dog bite. Like human bacteria is like really bad. So it's just a lot of information. If I have infertility, I'm struggling out there, or if I've had chronic endometritis, like, is that something that you would say it's important to go all the way up and look at the microbiome of the mouth then? Because there may be a connection all the way from top to bottom.
100%. I'm so glad you brought this up. So over 64% of endometriosis lesions have oral FN in them. That's huge. So anyone that has PCOS or anyone that has endometriosis absolutely should get an oral microbiome test because it could be, the mouth could be contributing to it. And as you said, when you see someone that just has overall signs of inflammation, now we need to start thinking like, okay, well, what can we do to reduce? What are the sources of inflammation and how do we reduce it? And the mouth is oftentimes one of the biggest sources of inflammation that is contributing to someone's systemic disease. So I deal with patients all the time that have endometriosis and they've done all the things, right? And it's not going away. And then they come in and we treat the oral FN and it definitely gets under control. In fact, in my practice, there's a really good story I put in my book on this topic. So she came in, this young woman, she was in her 20s, seemingly healthy, no medical conditions. And my hygienist was doing her exam and she came to me and she said, "Doc, I think something's really wrong with this patient. I need you to come in and take a look." And I go in there and her gums are just bloody. She is bleeding like a stuck pig. But when you look at her teeth actually look healthy. And so that's one of the signs to us of like, okay, well, if the teeth are healthy, then why is she bleeding so much? Something else is going on. And so we did a saliva test on her. She was off the charts for EPIN. So we did our typical protocol for treating this. And then she came back 3 months later for her recheck and she was better for sure, but still not great. And so I sent her to her doctor and we did a bunch of blood work and she ended up having systemic endometriosis. Lesions were in her lungs. And, I kind of lost track of her care over time. And one day I went to one of my other offices and I was trying to, just hang out with the team, make sure everything was going well at the practice. And this woman comes up to me and introduces herself. And I meet people all the time, like what you were saying, Jamie, before we got on about, you see people all the time. And so sometimes it can be a blur. And she said, and I said, "Oh, well, welcome to the team." She was a new employee at this office that I had. And she said, "I got into dentistry because you saved my life." And I said, what did I do? And she said, "You were the one that led me to figure out that I had endometriosis and my mouth was playing a component of that or playing a part in that. And so I wanted to get into dentistry to help other patients."
Whoa.
Right?
Whoa. Oh my gosh.
Yeah.
What's awesome is that this took a turn that we didn't expect because endometriosis and endometritis are two different things. Endometritis is like inflammation of the uterus. And so these are like, it's like this unexplained weird thing that causes this inflamed uterus. And we're always trying to work through like the biopsies and what bacteria is causing this and that, because that is an incredible story. And honestly, one I wouldn't have even thought to associate. I wouldn't have even thought to ask. So that was probably like a God thing for people who are struggling with this endometriosis, which is very frustrating in of itself. And like you're saying, it's like a systemic, acts like an autoimmune condition. So I want to talk so much about the saliva test. So when you're getting the saliva test and you're getting the results and you said the protocol and the treatment plan, like, what is that treatment plan? How easy is it for people to get the saliva test? Because I guarantee women are listening and they're like, okay, how do I do this? And how much is it cost?
So saliva test is really easy to get. There are a couple direct to consumer companies out there. So Bristle is one of them that people can go online and just buy themselves. I think it's like $150. Biome does another one that you can get direct to consumer. The difficulty then becomes, okay, well, how do you interpret it? What do the results mean, and who can actually treat the results? Because, I've been doing saliva testing since 2012. I teach on it all the time. I have a talk coming up in Florida at the end of the month. And it's very hard for providers to wrap their head around, okay, this is what I've been taught and this is what I know what to do. But now I'm using these test results that may not coincide with what I see clinically. How do I wrap my head around that? And how do I actually treat the patient? That's typically what I hear from providers. So if you get a D2C product, it's kind of hard to find a doc that will actually be able to use that information. Other times you can try and find a dentist that is doing saliva testing. A lot of biological dentists will do it. You just need to call their office and ask if they're doing a test. Or they can order it from my website too. We can ship it to them remotely. And we treat patients all over the country for this. And then once you get the results, depending on the bacteria or viruses that are present, that really tailors our treatment plan. So there's red complex pathogens that live in the gum tissue. That's why they're so dangerous to systemic health, is because they live in the gum tissue, which is right next to the blood supply. And those bacteria are actually resistant to the typical mechanical cleanings that you're going to get at your dental office. So then you need to use things like a tissue laser that can go in and clean that tissue and kill the bacteria. You can use medicaments. Iodine is one. I like to use ozone, aqueous ozone, and ozonated gas to kill those bacteria. So just depending on what's there. And then other things that we really want to do is try and balance the microbiome. So sometimes if an infection is really bad and they have a lot of red complex pathogens, I will recommend antibiotics, which is kind of like, whoa, you're a biodentist. Why are you recommending antibiotics? But we have a whole protocol of how we protect the gut if we're going to recommend those systemic antibiotics. And then we always want to repopulate the mouth with what we want to be there. So I'll put patients on a short course, 30 days of oral probiotics that are specifically meant to rebuild the oral microbiome. And then I am really a big believer in prebiotics for the mouth, because for probiotics, they're really transient in the mouth. Every time you drink, swallow, eat, brush your teeth, you're really kind of disrupting that microbiome. And so you constantly have to be putting in oral probiotics for them to be effective. So for me, once I eradicate the bad, I repopulate the good. Now I'm putting lots of prebiotics in the mouth to try and nurture that environment, if you will. So another product that I love is Protectin. Protectin has been, it really has blown my mind. I don't get paid by Protectin, but it's just something I believe in, because in the past, whenever I would see FN infection, my go-to is metronidazole and amoxicillin, which are heavy hitting antibiotics. But you guys know, especially in fertility, metronidazole is a lot of things that we treat for fertility, right? So it makes sense that it's connected. And so metronidazole was really effective at eliminating FN. But what I found is by doing case studies on my patients, Protectin for 90 days, if someone does mints and a water additive, it will knock out Protectin or knock out FN in the mouth and in the gut. And I have case studies on patients that we didn't even treat dentally. All we did for FN infection was give Protectin, and it wiped it out in 90 days, which was really cool. So I'm a big believer in that.
Whoa. I keep saying whoa. I don't know if I've said whoa so many times in an episode. Whoa. I just need to do a sponsor shout out here to thank a big thank you to We Heart Nutrition for supporting our podcast. We love their supplements. We love them. If you go to weheartnutrition.com and type genius at checkout, you get 20% off. Some examples of some supplements I take every day from We Heart Nutrition. So I'm working on getting my iron levels up, my ferritin levels up, all of this. So they now have an iron supplement as well as a 40 plus multi-supplement that I take every single day. So again, if you're looking for a good bioavailable supplement company, weheartnutrition.com, genius at checkout for 20% off. And then also Teresa and I are gearing up for season 7. And we're very excited. And so for those of you who've been listening with us throughout the seasons, we want to just say thank you so much. It would mean the world to us if you gave us a review, if you shared our podcast with a friend. We're really trying to get the word out there. We're trying to increase our review numbers. We do have an average of 5 stars, so that means a lot to us. So thank you so much for listening. So again, if you have not yet actually hit the follow button or left a review for us, push pause, do that now. It would mean so much. And lastly, if you are in perimenopause, you want to learn more, you feel totally clueless, go to our podcast website, hormonegenius.com. And right away at the banner, you'll see learn more about perimenopause. We have a perimenopause program, less than $100, and it will totally inform you about what is happening in the body and how to help take care of some of the symptoms and root issue things that many women are never told. So please do that. And thank you so much for being a listener. All right, Teresa, I'm going to punt the next question off to you.
Okay, well, let's go with the perimenopause theme. And you mentioned dry mouth, Dr. Katie, for perimenopause. I'm sure that's one, but there's probably other things that happen in perimenopause in relationship to the mouth and the changes that the hormones bring. And I want you to be able to kind of go deep with us a little bit more in what you're seeing in practice, because I think because we're paying attention to perimenopause so much more, I think even all of us who have been in practice for a long time, I don't know, I just think because everybody's talking about it, we're starting to kind of make connections that maybe we didn't make before, and we're learning more about these changes in the hormones. I want you to go deep dive. Also think about the heart, because I think heart disease in the mouth is also something that doesn't get talked a lot about, but is, I know, very important in terms of the health of the heart and your mouth. So I'll let you kind of just open up into that area.
Yeah, there's a lot there. And I want to start by saying I'm not an expert in perimenopause. And as you mentioned, there's really not a whole lot of information out there yet about perimenopause and how it relates to oral health. But I will speak to what I'm seeing in my practice because I'm going through perimenopause. And so I have a vested interest personally in this. But we're seeing a massive changes. And so estrogen is really important for a lot of things. One is, it's really our what do I want to say, youth, vitality kind of hormone, right? And as we lose that hormone, a lot of things start to happen. And so women oftentimes complain of vaginal dryness, right? Things start to get dry and they're not as comfortable as it used to be. But that's the same thing that's happening in the mouth, right? So we say it's lips to lips in our practice, right? So the mouth starts to get a lot drier. And when the mouth gets dry, a lot of bad things definitely start to happen. So our saliva is the protector of our teeth and our tissue. It's full of lots of nutrients, proteins, antibodies, all sorts of things. And it's supposed to coat our teeth, our gums, and our tissue. And when we no longer have that saliva, the bacteria stick to the teeth and gums, and we start to get a lot more cavities. So patients during perimenopause and menopause will get a lot more cavities because their mouth is dry. We'll also notice a lot more inflammation in the mouth. And that's because the bacteria are more directly attached to the teeth and gum tissues before they kind of have this barrier of protection on them. And so we start to see a lot more gum infection, a lot more cavities during this time. And then estrogen really plays a big role in bone metabolism. And so that's why as we age and estrogen starts to decrease, women can start getting things like osteoporosis or osteopenia. Well, guess what's holding our teeth in place? Bones. So when that process is happening in the body, you see it in the mouth. And then you couple that with the inflammation that's happening from the dry mouth. And we see kind of this exacerbated response of gum disease and bone loss and gum recession in patients. The other thing I talked about earlier is burning mouth. And so as the tissues start to dry out, patients can develop burning mouth. So sometimes that can be associated with just dry mouth. Sometimes it can be associated with vitamin deficiency, like vitamin B. It can also be associated with iron deficiency, but one of the first, and also a candida infection. So as the mouth gets drier, everyone has yeast in their mouth. It's a normal component of our microbiome, but as the mouth gets drier, we see yeast actually starts to proliferate. So there's lots of different tests that we can do to try and figure out what is causing this dry mouth. But really what we try and do is help women kind of balance their hormones, get that estrogen in a good spot, and a lot of the dryness symptoms go away.
So that's what you would say then to the woman who is experiencing her dry mouth. I like the lips to lips thing. That's funny.
Lips to lips.
Lips to lips. Funny. So that would be it. It'd be addressing the estrogen dilemma. Are there any other tips that you provide to women in regards to the low saliva and that phase off?
Oh gosh, so many. So another one that we want to address too is glucose, how the body is using insulin and glucose, because when that balance gets out of whack or becomes imbalanced, we get a lot of systemic inflammation, right? Diabetes is really an inflammation of the vasculature of the body. And so when we have inflammation inside our blood vessels, and you had mentioned heart disease, Teresa, that's really inflammation inside the heart, right? The vessels of the heart. And so what ends up happening is that inflammation in the blood vessels actually affects the salivary glands. And so the salivary glands will stop producing or will be unable to produce adequate saliva. So something else that we're always checking is the metabolic profile of the patients to make sure it's not a glucose issue too. Another big thing is hydration. And none of us get, or most of us don't get enough hydration. And if we are getting enough hydration, we're not putting electrolytes or minerals in our water. So that's something else that I see is that, people have really embraced drinking filtered water, which is critically important because our water systems are very toxic. But when you use something like RO, you're pulling everything out of the water. So you can drink. I have patients come in and we actually test their hydration levels before we do their airway treatments because if they're dehydrated, it'll be a bit spicier when we're doing the treatment. And so they're like, well, I just drank, four big gallons of water yesterday. I can't believe I'm still at 10%. I'm like, yeah, but are you putting salts or minerals or electrolytes in your water? Because if you're not going to absorb anything. So that's another big one. And then lastly would be airway at night. So as we age, this is what I'm seeing more than anything. And it's got me really excited right now. But as we age, I'm seeing sleep apnea in a majority of my perimenopause and menopause women, especially petite women. And what we're seeing, and the reason for that, and number one, we're the most overlooked patient population when it comes to sleep apnea. We think of sleep apnea as big obese men, right? Or big bodybuilders that have no neck. But my number one patient that I treat for her sleep apnea or upper airway resistance syndrome are petite women. And it's because when you're petite, you probably have a really small airway that you're born with. So we can actually measure the airway volume on our 3D cone beam scan that we take on patients when they come in. And it's not diagnostic, but it just tells us if you're dealing with a open pipe, right? Or if your pipe is already partially collapsed. Because if it's already partially collapsed, the chances are when you go to sleep at night, especially as we age and we lose our hormones, estrogen is responsible for our muscle tone, right? And so as our hormones drop, we notice, right? When you go to the gym, your muscles aren't as tight as they used to be. We also lose collagen as we age, and we also lose bone density. So all of the tissues in the neck and in the face collapse. And so you go to sleep at night, those muscles, everything collapses. You already have a small airway. It completely closes off. And now that patient has sleep apnea or upper airway resistance syndrome. The problem with that is oftentimes the mouth is open. So then you're breathing through your mouth at night. When you breathe through your mouth at night, you're not getting any nitric oxide production because that happens through nasal breathing. So your blood vessels are getting constricted. That's spiking systemic inflammation, and then the patient becomes inflamed. We also know that every time you stop breathing for 10 seconds or more, the alarm systems start going off in the brain that, oh my gosh, we're being poisoned. The carbon dioxide levels are going up too high. So your brain will send this rush of adrenaline to the brainstem to wake you up enough to take a breath. So the first thing that we do is we start grinding our lower jaw forward to try and open up that pipe so we can breathe. So we'll see a lot of clenching and grinding. The number one complaint I get from perimenopause and menopause women coming in is my TMJ hurts now out of nowhere. And usually it's like, oh, we got to check airway. But that constant influx of adrenaline is putting us in sympathetic nervous system, so fight or flight. And a lot of patients will start getting anxiety or panic attacks at this age. And usually their doctors just say, oh, it's menopause, it's perimenopause. And it's like, no, it's probably an airway issue. And so we'll see anxiety. We'll also see cortisol spikes. Sustained cortisol turns on systemic inflammation, also raises blood glucose. So a lot of women will say, I'm gaining this weight out of nowhere and I can't get it off. Well, it could be airway. And then we'll also see patients come in that say, I'm pre-diabetic out of nowhere and I eat really healthy. I don't know what's going on. Well, that's the sustained cortisol release that's coming from an airway issue. So all the things. So this is just what I'm noticing in my practice. Every perimenopause and menopause woman that come in, I recommend a sleep study off the bat, and they look at me like I'm crazy. And they're like, but I don't snore. I'm like, I don't snore either, and I have sleep apnea. Snoring is not indicative of sleep apnea.
This is great information. This is going to be so helpful for people. And for me in practice, I have a lot more patients asking me about sleep studies. So I think there is a little bit, there's an awareness, I think, going on that, one, sleep is just incredibly important. And I think you're right, because of the cortisol thing. Everybody, I think, is aware that cortisol can mess things up in terms of your ability to be metabolically healthy. And no woman wants to keep putting on weight. So they're like, how can I sleep better? They know they need that balance of the circadian rhythm. Here's a question about the sleep apnea, because in my mind, I'm like, okay, I send a patient to a sleep study. They've got sleep apnea or some sort of airway issue, and then they're going to recommend a CPAP from this sleep study. And I would imagine, and you can correct me if I'm wrong, that could be an issue also for the oral microbiome, shoving air into the throat and down the airway. So how do you approach that then? Because in my mind, I would want more of a fix that allowed me to breathe more naturally, not to have to again, I feel like it's kind of like a Band-Aid approach, like forcing air into the body. I know people feel better, but is there other ways we can approach that without having the CPAP?
I love that you brought that up because, yes, CPAPs are sometimes necessary. So I want to say that. But I'm talking about the majority of cases. You're absolutely right. It doesn't fix the issue. All it's doing is blowing air in the mouth. And as we talked about earlier, when you blow air in the mouth or you're breathing through the mouth, you're not getting nitric oxide production. You're also drying out the tissues. So I see all my CPAP patients that come in all have gingival inflammation on the front of their mouth, all of them, because they're getting air right there. They all also had increased cavities. The other thing that we see with CPAP patients is their tissue in the back of the throat actually becomes more flaccid and weak. And so it actually makes, if they don't wear the CPAP, it makes their apnea worse because that tissue is just not being toned. So what we do in our office, if the patient is a good candidate, which majority of them are, we start, and depending on how severe their sleep apnea is, we'll recommend something called night laze procedure. And so what we're doing, it's a non-ablative laser. So we're not burning, we're not cutting tissue. What we're doing is we're putting energy into the tissues of the mouth to tighten and contract the collagen. So I'll treat the floor of the mouth that pulls the tongue forward. Then I'll treat the back of the throat that tightens and opens the airway. And then we'll treat the top of the tongue because I don't know if you've ever noticed, but people have really fat, big tongues. And so one thing that people can do to look is if you stick your tongue out, look in the mirror, and the sides of your tongue are scalloped, your tongue is too big for your mouth, and you probably have an airway issue. So we'll actually treat the sides of the tongue and the top of the tongue to thin it out. And we can get great results and completely eradicate apnea by doing that procedure. It takes multiple visits that are each about 3 weeks apart. And then after we get patients to a point where we're comfortable that they don't have apnea, then they come in once every 6 months to a year just for one treatment to keep things toned. We also have a myofunctional therapist in our office. And so I tell people, I can treat your collagen, but I need you to get a personal trainer for your mouth, essentially. And so I want them to see the myofunctional therapist so that she can recommend exercises to strengthen the muscles of the airway. And that way they can get some sustained results because we gotta work out the airway and the mouth just like we work out our bodies. The other approach that we'll take is, again, depending on the patient and the results, is sometimes we'll make them an oral appliance. So those are called a mandibular advancement device. And so what I want to kind of dispel about those devices is a lot of people think, oh, those aren't great because you're pulling the jaw super forward and that can cause TMJ issues and bite changes. And yes, that is true if you're pulling the patient really far forward. For me, what I'm trying to do is I'm more trying to prevent the jaw from going back and falling back and closing the airway versus actually pulling the patient super forward. So I usually will pull patients to where their front top and bottom teeth are just edge to edge. So I'll put patients just edge to edge in their bite. And usually that's enough to keep their airway open. And sometimes we do combo therapy. So if they're pretty severe apnea patient, we'll do an appliance with the laser treatment, and we get really great results for that. And then we always post-test our patients. So I never do treatment and then just say, you're good, I'll see you in a year. I actually do a post-test to make sure that the patient no longer has sleep apnea before we release them from treatment. And then we recommend testing once a year just to make sure that they're still good. Because as we age, things keep sagging, so you have to keep modifying the treatment.
Oh my gosh, I want you to move to my town. Can you do that? Probably not. I can imagine. With this sleep apnea thing, again, this is like, oh my gosh, I'm even thinking in my head, how do we make this like a part 2 episode? But part 3, really, because this is your second time. With the sleep apnea thing, but without doing a sleep study, you mentioned one way, like if you have a really big fat tongue and it's like scalped on the back edges, that would be one way to know that maybe this is something actually that you struggle with at night, sleep apnea. What are some other ways to kind of guess?
Lots of them. Oh gosh, lots of them. Clenching and grinding. If someone's like, I'm a severe clencher grinder, if you look at your teeth and your front teeth are worn down or chipped, that means you're grinding forward in the middle of the night.
The front, the top, the
front. Yeah, front, top and bottom.
Okay.
Yep. But it's pretty severe. Yours, I can't see yours up close, but you look fine.
Yeah.
It's pretty severe. You'll know it. Now you guys will all be going around looking at people's teeth. And if you see they have short front teeth or like jagged front, that's airway.
Oh.
TMJ for women. We get a lot of TMJ complaints. In younger people, so let's say kids, teenagers, 20s, they'll have allergies. They can't breathe through their nose. They're mouth breathers. Young kids will get chronic sore throats, chronic respiratory infections, chronic ear infections. That's airway, which I'm working on the business right now. We're trying to figure out how do we treat all these little kids because I don't want them getting their tonsils out. So we're trying to figure out how we can help those people. But in adults, if you're on 2 or more blood pressure medications, dead giveaway. I was treating, it's always the wives that bring in their husbands. I was treating this executive in my office. He's, probably mid 40s, maybe upper 40s, executive of a big company, healthy guy, fit, works out. He was on 3 blood pressure medications and on his way to AFib. His dad had AFib. His brother has AFib. And he's like, how do I keep getting AFib? And his wife's like, well, he snores. I'm like, you got to bring him in here. Let me see him. He ended up having severe sleep apnea, stop breathing more than 60 times an hour. And so we got him in an appliance right away and then started doing the night lace procedure. And within 1 month, he was off 2 of his 3 blood pressure medications. So if you're on 2 or more blood pressure medications, if you have AFib, diabetics, there's an 85% correlation with diabetes. Again, spike in cortisol, right, raises blood glucose. So diabetic patients should be tested. And then if you look at someone and they have big dark bags under their eyes, that's airway.
Okay.
So all these things. Yeah, all these things.
Yeah, this is so important because this is root cause medicine, but it's getting to the heart of so many big time systemic diseases. I mean, these are the things that take people off this planet. So it's just so important to think about like how you breathe and the health of your mouth when it comes to your health overall. And I'm sure a lot of wives are now, oh my gosh, I got to get my husband to get a sleep test because they're just thinking, oh my gosh, I am seeing this in the people that I love. I have to ask this, Dr. Katie, because my daughter, I'm like, oh my gosh, I have an opportunity to ask an expert. She gets tonsil stones. And you just mentioned tonsils, so it made me think of it. And I've tried to like help her, and she got like a device on Instagram where you like have a water pick you shoot back there. I've tried to get her like a more natural kind of gargle wash that she could use. But is there any, I don't know if it's just that, her tonsils genetically are the way they are and it's just prone to that, or is there some underlying reason she's more prone to tonsil stones? And then as a part of that, why should we want to keep our tonsils versus, I think taking tonsils out is something people think, oh, we just take your tonsils out. No, we just do it.
It's a rite of passage. Yeah.
That might not be the greatest idea. So 2-part question there.
Okay. Well, caveat, I am not a pediatric dentist. I am not an ENT. So please take what I say here with a grain of salt. This is just based on clinical experience. So yes, some people are born with just more cryptic tonsils. Cryptic means they have these little pouches in there that collect things. When you're getting tonsil stones, again, it's my understanding that it's a collection of all the things that are draining in the mouth, right? So it's things that are coming in through the mouth, but it's also a lot of times what's coming down from the nose and the sinus cavity. Again, my understanding. And then when they stay there over time, they harden into these stones. And so what I would recommend doing is figuring out, is she a mouth breather or a nasal breather? That's one question I have.
I actually don't know. And she's 17, so she is a little older, but I don't know. I have no idea. So that's the first
So
thing
watch her when she's just sitting there. Are her lips closed? And is she breathing through her nose? The next thing is watch what she's doing at night, because she could be a mouth breather at night. Again, that's creating a lot of inflammation in the mouth. That creates a lot of sinus congestion. And then people will complain of post-nasal drip. And they'll complain of acid reflux. That's another one that we'll hear a lot of. So see what she's doing at night. Mouth tape might be a really good option for her. And then the other thing that we, I always recommend make sure we're testing for food allergies that's not causing inflammation in the sinuses and causing drainage. Mold is another big one that my functional providers are always recommending if someone's getting a lot of sinus issues and chronic allergies. So food, mold, or food and environmental exposures. And then the next thing is going to be airway. Did she have an expander when she was growing up? Did she have a palate or expander?
No, but she did have braces and all that, but her teeth are good. But interestingly, she is an allergy kid, so it's just seasonal kind of allergies. She did the marching thing, where she always rubbed her nose, and she cleared her throat all the time, even as a 3 to 4 year old. In fact, and she snorted a lot. So like the preschool teacher, even like one day she brought her home and said, "You got to stop her snorting." But the snorting was like a tickling. She was taking right? And so a lot of people do that to kind of scratch the back of her throat. Interestingly, more recently, she's been talking about acid reflux. She never really She's been telling me, that she's getting that burning in her throat. So, yeah.
I would do a sleep study. Yeah, I would do a sleep study for her. Did she have any teeth extracted for braces?
I think she probably did. I can't remember. I have 8 kids, so like they all blend together with.
Bless you, woman. Yes, you.
Yeah.
And I have one and I'm barely surviving.
I'm on number 6 braces right now. Talk about college and then braces. There's all my money's going to, but
and then weddings.
Oh my gosh, and the weddings. Thankfully, I have 6 boys, so maybe we'll get a little bit better on the weddings. I don't know. It's not traditional anymore, but yes. But
so I would get her a sleep test. So again, I don't want to rock the boat when I say this, but I have seen in my practice, I don't have research on this, but in my practice, 100% of adults who have had premolars extracted for braces as a kid have sleep apnea.
Wow.
Because what happens is the jaw doesn't form properly. So when we're young, does she have a tongue tie or a lip tie? Okay. I mean, I'll have you send me some photos. So what typically happens is, the tongue is supposed to be, again, not my functional therapist. This is just what I'm learning from my team. The tip of the tongue and the whole tongue should really be up on the palate when you're at rest. So when you're sitting, not talking or chewing, your tongue should be up on the palate. The tongue getting up to the palate takes the palate from being a vaulted palate to being like this, a U-shaped palate. That is also the floor of our sinuses. And that opens up our airway and really guides our development. And so when the tongue can't do its job, we get these high vaulted palates, which impact our airway cavities, less room for breathing. Our jaws don't form properly. And then we get small jaws with a lot of teeth. And so what happened in the past is a lot of orthodontists would say, okay, well, we have too many teeth for the size jaw that you have. So we're going to pull your teeth and align everything and make it look pretty. Well, the problem is now we've made everything smaller and now our tongues really can't fit in our mouth. And then we develop a lot of airway stuff. So this is what I'm seeing in my practice right now with kiddos is all these kids are coming in with airway issues and the ENTs are wanting to take out tonsils. The orthodontists are wanting to pull teeth. And I'm like, no. Let's expand the jaws to fit the teeth that God gave us, right? Like there's a reason why we have all these teeth. Let's expand the jaws, make room for the teeth. And then usually everything else will start to resolve. Obviously, we get those kiddos in myofunctional therapy right away to teach them how to use their tongue. We do a lot of we refer out for a lot of expanders to try and get that upper jaw in the position that it needs to be and the size that it needs to be. And then we can actually use our laser and go back and zap those tonsils to get the inflammation down and get them to shrink. Now, there still are times, right, when people need to get their adenoids out if they're just too big and we can't get them to resolve. But oftentimes we try and treat root cause. We fix root cause and a lot of these things resolve. Again, not a pediatric dentist, but all these moms are bringing us their kids saying, can you help them? And so we're doing a lot of experimental things, bringing in some experts that I know of, trying to coach us and guide us on how we can help these kiddos.
Wow. I have a 13-year-old and you're going to die, Dr. Katie, because he just had braces put in, my 13-year-old. And I was told I always had a small mouth. So I had premolars taken out when I got braces. I mean, everybody tells me I have nice teeth and I really do have really great teeth, but they had to take out multiple molars. So my son just they took out 4 of his back molars because his mouth is too crowded, they said. And he has big teeth, crowded mouth. But when he brought those teeth home from the dentist, I pulled them out of the little teeth bag And I looked at those and almost cried because they were the most beautiful teeth and they had the longest roots in them. And I kind of thought of like a holistic dentist right away. I mean, I kind of thought of our last podcast episode and I thought you would probably die looking at that thing. Like, why did you take out those beautiful teeth? But I don't know. It's just one of those things where like you're subject to the standard of care. I mean, we say this in medicine all the time. And that's the orthodontist that put my braces on. We've sent all of my kids to them. They're doing the standard of care. They obviously don't think they're doing anything wrong. And I don't know. I just knew looking at those teeth, I'm like, that is not meant to be. That is not what we should have happen. Maybe it does. Maybe we've made, but like those beautiful teeth shouldn't have had to come out.
It's definitely the standard of care. I want to say that. And when you talk to orthodontists, they think that what I'm saying and what other biologic dentists are saying, some of them think that we're crazy, right? It's like, no, you just need to pull the teeth and shrink everything in. So I definitely want to clarify that they are doing what they believe is the standard of care. So they're not purposely doing anything wrong, but I'm seeing the ramifications of that in my practice as adults, right?
Oh my gosh. Katie. Whoa. Oh my heavens. Okay, girl. We have run out of time. And
I know. Yeah, I was just texting I have another call and he's like, where are you? I'm like, I'm coming, I promise. Okay. But this is such a fine conversation. This is the way I'm learning every day. I got into this and I wasn't doing anything with kids. I never wanted to treat kids. And now all of a sudden I'm finding myself like, we got to treat kids. We got to figure out how to do this.
Yeah, totally. Like, we're not going to go off on it. I learned so much from you just mentoring Teresa here. Like, my son is 9 and was tested for allergies, 34 of 38 allergens, huge hives, huge tonsils all the time, definitely mouth breathes, for sure at night. He definitely has sleep apnea. I can hear it when he sleeps. And they're like, yeah, adenoids, take up the tonsils, do all these things. And I'm like, I can't and I don't want to. But
okay, well, call me and we'll talk offline.
Thank you.
Get you some help. You're welcome.
Thank you so much. Okay. So with that, Katie, what do you wish every woman knew about her hormone genius? Wrapping it back into the hormones here as we end. But Katie, how would you answer that question? What do you wish every woman knew about her hormone genius?
I would just say, like, don't accept the statement of, oh, it's just perimenopause or menopause. We have the right and should feel our best at all times. And so when someone blankets your symptoms and dismisses them of it's just perimenopause or menopause, like, don't accept that. You deserve better. Go figure out what's causing it.
Awesome. And just let everybody know your, like, where you're at, your details, whatever you want to share, your book as well. Tell them about the book and we'll wrap up there.
Yeah. So I wrote a book called Saved by the Mouth. It's all about stories in my practice of patients that came in with certain systemic diseases or symptoms and how we were able to improve their condition by improving the mouth. And then my practice is Collective Health Society. So they can go to www.collectivehealthsociety.com. You can book a consultation with me. We can also ship saliva tests remotely. We can ship you a sleep test remotely. So we have lots of different capabilities there. And I also do second opinions for a lot of people that just have questions about, some information had been given from doctors. And then they can find me on Instagram at Katie Lee DDS.
Awesome. Thank you so much. And thanks for spending the extra time with us today. We really appreciate it. We will probably have to have a part 3. We just learned, like Jamie said, we're just like mind blown by so much great information. And I know our listeners really appreciate it. You have a blessed day and we will talk to you real soon.
Thank you. Bye, guys.
Thanks for listening to the Hormone Genius Podcast. Please remember to share our podcast with your friends and family, and also follow us on social media. If you were not aware, we have a YouTube channel. So if you could like and subscribe to our YouTube channel to stay in the loop with all of our latest episodes, we would appreciate that. Thank you so much for your support. We are excited to journey alongside you as you discover the beauty and the genius of your hormones.